I do every day in my clinic. So the patient arrives, and then I'll ask him, what the hell are you here for? That's why I have Marcus translated, so he can soften everything.
Ja, also wenn der,
I'm not as outrageous as I claim to be.
wenn der Patient kommt, dann sagt er, was zur Hölle machst du?
Usually about 7 o'clock at night, then it gets pretty bad. But
Ja.
in the morning, things are okay. So what I'll do is this. Don't worry if you cannot feel these certain little things. Because if you can't feel them, they're not worth treating in. What you're going to treat clinically are the big things. Big ones. And the big ones you can't help but feel. Like a turtle pulse, if there is damage, if there's a bad varicose seal about to burst, you'll feel it, and it's pounding, and it talks to you. But if you're having, gee, I can't really quite feel that, do I? Their back pain is so minimal, you wouldn't treat it anyway. Okay, so don't worry too much. So what I'm going to do is I'm going to go through each and every one of you, and I'll tell you what's the matter, what's really the matter, and then I'll tell you which herbs. You can write the herbs down, and even though you have this PDF and it tells you what herbs go with what pulse, I will just create these herbs on the spot now for you to try to give you a little bit more advanced idea how to do this, rather than paint by numbers through a PDF system. You understand what I'm saying? Because nothing is exact. Everything, in a clinic, everything's fluid. And so that's how we're going to do it. Hopefully it'll work, okay? So, and Bob. Okay, here's what's wrong. Susanna has a chronic allergy problem, wind cold. She's going to get problems here, easy. And it's coming in from the air. And she's too tired. Good eyes, but she's tired. And she has a very sensitive stomach. She has a liver invading her stomach. Stomach pulse is very thin and wiry. Her neck is probably an old whiplash problem. Did you get in a car accident a long time ago? Did your neck did you fall off a horse or something? Yeah, what happened? Car accident. Yeah, she got whiplash. This is 15. Yeah. This is classic whiplash. It's what it feels like. Goes right on up her arm. Clear. This is not something you have to guess about. Anybody here can feel this. And so she's going to have neck problems. And maybe headaches. So there's that. She has a sensitive stomach. She's too tired. How do I know she's too tired? Because this allergy, this wind allergy, when I push on it, it just disappears. So she has sinus congestion. And if when I look at her, do your eyes bother you at all? From itchy eyes, runny nose, that kind of thing. Yeah, just every day. So this is your typical wind cold allergy. This is, nose is cold. This is wind cold. If this was wind heat, there's no way in hell her nose is going to be cold. Now it might have been cold just coming outside, but she's been sitting there. So if this was a wind heat allergy, the nose would be hot. So we have to use wind cold kind of allergy herbs. And we have to put in Huang Qi into the formula, because the reason she can't get over the allergies is because she's too tired. She might have a thyroid problem. It's possible. Thyroid might be weak. But she's tired, this one.
What's the right swing pulse?
Yeah. Okay?
It's right soon, right.
It's right soon, yeah.
What is it?
Oh, it's very thin, wiry, and weak. Thin, wiry, weak.
In which level?
It's in the middle. The stomach pulse is in the middle, extremely wiry. Do you get stomach pain? Yeah, stomach. This is pain. Whenever you have extremely thin pulses in the stomach, right one, they're going to have stomach pain. And take a look. You always want to look at the temperature here, at the elbow. Not with this, with this. He looks good. Good couple. What do you do?
Me?
Yeah.
Commodities.
You trade commodities?
Yeah, finance trade commodities.
What kind of things?
Iron ore, coal, steel. Aluminum.
That's how I made all my
Everything which is
money.
hot.
I made all my money trading.
Really?
I was an oil trader.
Bob used to be a commodity trader.
I was a commodity trader,
Never-
petroleum.
Okay.
Look at him. This is what they look like. They're completely outrageous, just like me. Comes from all that background. Commodity trader, it's really good. You don't see many of them. Good luck to you.